afternoon. Can you hear me all okay? Brilliant. My name is Shada Zodi. I'm a research director at Bold Insight, which is a UX research and human factors agency. My background is a clinician, so I worked in the NHS for a number of years in obs and gynae before joining product development, and then focused predominantly in the last 7 years or so on SAMD products, so software as a medical device, and a lot of my work's been in FemTech space. So I'm excited also to be joined by Sandra here. I had the pleasure of collaborating with her on her project, and over to you, Sandra, to introduce yourself.
Yeah, sure. Hi, everyone. I'm Sandra Wakaha. I'm a biomedical engineer, and I'm the founder of L-Scope. So L-Scope is a FemTech startup. We're on a mission to close the health inequality gap in maternity care through improved psychosocial screening for women.
Brilliant, thank you. So in the next 20 minutes or so, we wanted to kind of talk to you a little bit about the importance of user experience, in particular in the early stage. So if you're a kind of startup founder, or you're kind of starting out with a problem statement, and you really want to kind of guide development as accurately as you can based on the users and those that you intend to develop for. So with that in mind, wanted to tell you a little bit about our collaboration. So it was kind of centered around three main pillars, if you like, and one area was kind of understanding the challenge deeply, so having kind of short-term goals as well as long-term goals, but you kind of have to take a step back and just understand the problem that we're solving for in the bigger context, right, in terms of the workflows that we're designing for and how it can potentially fit into the existing system. So that interoperability portion is key, really. And to do that, obviously, we had a great team that were put together. So we had researchers, designers, Sandra and her team were clinicians on there, and we conducted a number of different methodologies that led us to go through a very successful round of research and design. But everybody was remote, so kind of the key is when you bring in remote teams together, kind of with different commitments, different time zones, that using appropriate technology kind of makes the experience much more effective. And with startups, of course, you need to have tangible results at the end of the day, because resources pretty constrained, time is of essence, so it's kind of key to get those collaboration and the interactions right from the start. And then, of course, the rapid development I touched on, so that's kind of part of it, and everybody needs to kind of be on board in terms of what you're working towards and the goals and the bigger picture, as well as kind of the smaller bite-sized objectives that you want to achieve as you kind of go through this iterative cycle. Right, so I want to kind of take a step back. Initially, obviously, we're going to focus on early user experience and importance of that in startup space, but obviously there's a much bigger spectrum there. So early on, you'll be looking at kind of exploratory research, so thinking about your users and the problem statement, and just understanding the workflows and kind of gaining a little bit of an understanding of what you're solving for, essentially. And there are a variety of methodologies that you can use to do that. So you have obviously user interviews. It can be done remotely or in person. There are a number of interesting methodologies, such as ethnographic research. So you're able to, in fact, kind of spend a day in the shoes of a clinician, just to kind of follow them around, understand how they interact with their environment and the tasks that they perform. So it's much better to kind of put yourself in their shoes rather than kind of be developing behind closed doors, and then further down the line sort of thinking about, we may have to backtrack a little bit. So that kind of moves you to more of like formative designs, and those are, again, early on, but there are lots of different methodologies like focus group, advisory boards that you can implement there. They're really important. And then obviously design, and towards the end of the development cycle, where you're ready to go into the market, depending on the type of the software and obviously what class of medical device it is, it will be different how you would validate it. But that's a much more rigid process. And then into the post-market, and there's lots of different ways you could approach post-market evaluations there. So that kind of gives you a whole spectrum, but we're kind of going to zoom in more into the exploratory and the formative side of things, and then walk you through some tips and tricks and some real-life examples there. So, of course, we all know that the healthcare system is extremely complex, and on paper you might think that you can solve a problem linearly with a team, but really in reality there's lots of different ways you can go about it, and it's all about taking that sort of zoomed out approach, looking at the big picture and understanding actually what are some of the different ways in which this problem could potentially be solved. But of course it's never so simple. You never get from A to B in a linear fashion, and I think it's important to really take a step back, and none of us kind of developers, designers, researchers kind of set out intentionally to create bad experiences. But of course there are many, and it's important to create delightful experiences at the end of the day, because we want people to be able to utilize these great tools to hopefully make a greater impact and improve patient lives. So I think my experience kind of sums it up in this slide, in terms of it's really important to think about the interaction between these three areas. So not just looking at the people or the environment in isolation, but also looking at it in combination. So with the people and the environments and the tasks and how they interact. So in what environment, what tasks they're performing, what are the types of pressures, and what other potential softwares that they have to interact with. So as an example, just thinking about the logging process, for example, you don't want another software that the clinicians have to have yet another sort of login page to log into on top of the hundreds of other logins that they've got to go through. So it's all about kind of thinking about those different journeys and making sure that you have them as smoothly as possible kind of put together, so that you're improving the user experience, improving efficiency, and of course that improves adoption and stickiness at the end of the day, and you want people to use that software. So a kind of quick overview of the approach we typically take in early UX testing, and this kind of just gets a little bit augmented depending on the type of testing, but it's very much a collaborative approach. It's an iterative approach, work with the main stakeholders, making sure that we have the right people on board, and we have input from the actual users. So for example, recruitment is an essential part when you're thinking about better understanding your users. Even if you are a clinician who works in that problem area, your perspective is slightly different potentially to somebody else's, and the way they interact may be different. So it's important to get kind of diverse feedback from your sample users, and obviously that kind of feeds into your whole data collection process, and of course into your analysis, and provides you with really actionable insights. But it's important to kind of get that initial stage right. So with that, I just wanted to show you a few methodologies that we typically use, and there's pros and cons with each of these. It just depends on your requirements and essentially what your goals are, but typically remote studies are pretty easy to do at this point, especially post-pandemic. We have the technology and the tools to be able to effectively conduct remote studies, and one good side on that would be essentially it's very cost effective, but it doesn't work for everything. So if you have a physical asset, for example, and you just have a couple of prototypes, you're not going to be able to kind of send all of that to your sample users. So, sometimes in lab or in home may be a better option there. So it just all depends, but that just kind of gives you an idea of what are some of the different ways that you can actually collect data, essentially to feed into your whole development and design process. Right, so with that, I'll pass it on to Sandra, who'll talk to you about LScope. Thank you.
Thanks, Shada. LScope and Bold Insight collaborated on this project, which was around developing our first user interface. So a little bit more about what we've developed. We've developed a tool called MP Risk, which is essentially software as a medical device to better risk assess pregnancy. And we're looking at not just medical risk factors, but also psychosocial risk factors, because we know that the social context of a woman is just as important as her medical history. And so the objectives that we had in this project were to, first of all, understand what were the needs of clinicians. So, of course, as engineers and developers, which is what my team is, we were really passionate about developing technology that would solve a problem. And so that problem typically is a patient problem, a health outcome problem, but there's so much more around that. It's also about, the clinical convenience, the efficiency of running a clinic and how the technology can support that. Also, we wanted to document the existing workflows of the intended users and identify what were the gaps in those workflows and what were the key pain points for clinicians. And then finally, we really appreciated the importance of iteratively designing. And this is why we wanted to really work with Bold Insight, is because, as a small startup, we don't have the resources to sort of, keep running experiments with clinicians. And so we wanted to enlist a third party to do that for us. But also it was really important to ensure that, as technology developers, that we step back from that UI design process so that clinicians could be really free to provide unfiltered opinions about our user interface designs. And so this is the approach that we took, and the aim was to design for adoption. We wanted our technology to somewhat guarantee, if you like, that clinicians would accept the technology at the end of the process. And so we held 2 workshops with designers at Bold Insight, with all of the clinicians that are part of the intended user population, which for us were GPs that are involved in the shared antenatal care pathway, which oftentimes is the case for some patients, but also, of course, midwives and obstetricians. And we conducted 18 interviews with clinicians, as well as had 2 advisory boards across 3 cycles to ensure alignment with clinical needs. And in these 3 cycles, the first cycle was all about establishing the level of explainability of our AI algorithms that needed to feature on the user interface. So how much the clinicians want to know about the inner workings of our algorithms. Then in the second cycle, we revised the design and also gathered more feedback. And finally, in the third cycle, we finalized the prototype, which had higher fidelity. So here is just a bit of a schematic, so a map that came out of the workshop, the initial workshop that we ran with our stakeholders and participants. And this really mapped out how we envisioned our software to integrate into a maternity service. And this was really important in order to then identify the user personas, the critical user journeys, the requirements for system integration, and so on. So here, just taking you back to the previous slide, and this is really just to show you this iterative process again. So once we had a design iteration, we then ran lots of user testing with the advisory boards, and then also analyzed and reported back. So what was the key deliverable? The deliverable was that we were able to develop a mid to high fidelity interactive prototype. And this was really crucial at the stage at which we were at for a number of reasons. First of all, it enabled us to achieve a few things, I guess. The first was that we were able to now have something that we could display to our clinical advisors. And so that really enabled for more insightful conversations than, not having a user display. The second thing that it also did for us is that it enabled us to run validation experiments really early in the process. And with that, we were able to progress to the next stage in our product development, which was developing an MVP. And I think also it was to do with the fact that now we were able to collect the sort of feedback on acceptability, real use of the technology without sort of going through the clinical investigation, which we did anyway. So that's actually on the way. But it was just really nice to anticipate the likely use of our technology by the clinicians. Because we all know that there's sometimes deviations between the intended use and the actual use of the technology. And so some of the successes were that we were, by partnering with Bold Insight, we were able to really take that step back. The design process of the UI was impartial. And that really enabled us to focus on bringing the whole product together, so the back end with the front end. And also in terms of what I said earlier, so we interviewed 18 clinicians. We felt that was quite a significant number of clinicians that we were able to interview at such an early stage. And yeah, I think, again, because of the limited resources of a startup, having a third party do that for you is really, really vital. And the timing of that was really key for us. And so just to land here, I guess this is a bit cliche to say, but truly one size does not fit all. And so my journey around developing the user interface may not be the same as yours, but certainly some of the key takeaways for us were engaging with clinicians as quickly as possible, giving them something to look at, because without something to look at, they can't give you the feedback that you actually need. So that's really vital. And even if you feel as though you don't quite have it right, perhaps the software, it's not where you want it to be, it's still really important for you to get that in front of clinicians as quickly as possible. Also, what it enabled us to do was to have, early testers, which eventually would become, hopefully, early advocates of our technology. And so I would highly recommend to bring on board as many testers as possible. But then equally, don't do too much too soon. So learn the importance of taking a lean approach, knowing when to stop in this process, knowing when you've gathered enough feedback, enough to then test, and if needed, then redesign. So what was the payoff for us going through this work? It was being able to develop new NHS partnerships because we're able to have more interactive conversations with them and put the software in front of them really early. That also enabled us to really gather or have more perceived value from the end user. And also, I would say that built a lot of trust from our end users, because it meant that, for each end user, they could see how we actually integrated the feedback that they had given us. And so I'll conclude here so that we have time for questions. But thank you so much for listening.
Thank you. Maybe we have a couple of minutes for questions real quick, if there are any burning questions. Otherwise, we'll also be around so you can grab either of us for questions. No? Okay, I think we're good. Thank you so much. Okay.
Thank you.
Thank you. So we're going to be having a short break now, and the final session would be at 2:30. So we hope to see you there again.